And that's what we're debating right now on Capitol Hill. And decisions that will be made by the House and by the Senate will decide what families across America have when it comes to protection for health care for themselves and their kids. If you've ever been a parent with a sick child and didn't have health insurance, you'll never forget it as long as you live. I know. I was there once. And if you've been through that experience, you want to make sure that you never reach that point again. You always want to have health insurance, and you want to make sure that other families are going to have that opportunity as well. One of the most important elements in the Affordable Care Act and health care reform was to make sure that everybody could buy health insurance. Hard to believe it wasn't that long ago, 6 or 7 years ago, that if you happen to have a pre-existing condition, insurance companies could turn you down, not sell you any insurance or sell you insurance at high prices that you might not be able to afford. We changed that. And we discriminate against any American because there is some health history in their family. It turned out the insurance companies didn't just identify the most serious illnesses as pre-existing conditions. They went into extreme definitions. So it wasn't just those who were cancer survivors or those who had diabetes or anyone who has been through a heart issue. It became women who were categorized as pre-existing conditions just by virtue of their gender, or if someone had had a particular issue with acne as a teenager, they might be disqualified from health insurance by some companies because of a pre-existing condition. We believe that this is worth fighting for, to make sure that every single family and their kids, regardless of pre-existing conditions, are going to have access to affordable health insurance. Earlier this month, the House of Representatives passed a piece of legislation that would repeal the Affordable Care Act. The bill would inflict serious harm on tens of millions of people nationwide, especially the 130 million Americans with pre-existing conditions, 5.5 million in my state of Illinois. And as I said, pre-existing conditions can include asthma, allergies, breast cancer, sickle cell anemia, diabetes, obesity, heart disease, to hernia. Thanks to the Affordable Care Act, insurers can no longer deny coverage to people with pre-existing conditions, no longer charge them more, or drop them when they get sick. Trumpcare threatens to rip these protections away. It would allow states to receive waivers, which means to avoid any requirement to sell to persons with pre-existing conditions. It would allow insurers to once again charge people dramatically higher premiums with pre-existing conditions or to deny them coverage. And when these people inevitably couldn't afford to pay the high premiums under the new Trumpcare approach, well, they came up with a fig leaf, as Senator King mentioned, and they said, well, you can be part of a high-risk pool. Those of us with any memory of the subject remember what those high-risk pools were all about. They were high-risk, high-premium, and they were hard to get into and too expensive for many families to even consider. We want to make sure that we continue to have reliable coverage for all families across America. There are currently 2.2 million people with pre-existing conditions who buy insurance through the Affordable Care Act individual market. Trumpcare includes enough money just to cover 600,000 of them, about 27%. What about the other 73% that are not going to be protected under Trumpcare? That's exactly the question that keeps us worrying about what the Republicans are going to do to our health care in America and keeps a lot of families up at night. I'm going to ask Senator King of Maine to join me, then Senator Schatz of Hawaii, and we have a number of families here who can get up and tell a little bit about their stories, what they have been through. So first, Senator Angus King of Maine.
I was thinking as Senator Durbin was speaking about what we would like a health care program to look like in this country, and the President has really defined it: coverage for all at reasonable prices, low deductibles, and full coverage for pre-existing conditions. I think that's a pretty good plan. It's called the Affordable Care Act. And the plan that has passed the House is the antithesis of that plan. It covers far fewer people. We'll find out this afternoon how many fewer it will cover. And it certainly doesn't cover people with preconditions. They added a provision at the last minute, and I do call it the fig leaf pre-existing conditions provision, that allowed people to say, yes, our bill covers pre-existing conditions. But what it does is create the high-risk pool, but then doesn't fund them adequately. You can't just call it a high-risk pool or a pre-existing condition protection and then have it not function in real life for that reason. We had, ironically, the House bill talked about modeling a Maine plan that was passed in 2011 that did create a high-risk pool, but it funded it adequately to cover the people in it. And the provision in the House bill, the money that's available, is about 20% of what the Maine plan costs per person in order to meet the coverage of pre-existing conditions. I feel particularly strongly about this, and I feel strongly about the whole issue of health insurance for a very personal reason. 40 years ago, I worked here. I was a staff member, and as such, I had insurance. And part of the insurance plan that I had through the U.S. Senate in those days had part of it was prevention and preventive care and a free checkup. That's part, by the way, of the Affordable Care Act. Requires to have a free checkup and free preventive care. Because I had that free checkup, I was 28, 29 years old. I was immortal, but I figured it's free. Why not? And I went and had a checkup. And in the course of that checkup, it was discovered that I had a little mole on my back, which turned out to be something called malignant melanoma. And malignant melanoma is a particularly virulent form of cancer, which you either catch it in time or you're a goner. There's pretty much nothing in between. And I had surgery, and here I am. But what's always haunted me since that day was that somewhere in America that year, 1974, there was a young man who also had a mole on his back, but who didn't have insurance, didn't have access to the care that I got. And he's gone. And that's not fair. In the richest country in the world, to have life or death be decided by the accident of whether or not you had health insurance is just not right. And so that's why the bill that passed the House, to me, is such a cruel joke on the American people. It will drastically increase the number of people who are uninsured, and it will not cover pre-existing conditions. It will not lower deductibles. It will not lower premiums. It will not increase the number of people that are covered. So this, for me, is a matter of policy, but finally, it's a matter of people. We're not talking about ideology here. We're not talking about free markets. We're not talking about some, policy and philosophy and ideology. We're talking about people and people's lives and their ability to have the most fundamental right of all, the right to live their lives. Life, liberty, and the pursuit of happiness. The first one was life. And that's what we're talking about here today. So I want to thank Senator Durbin for his leadership on this. I was not here when the Affordable Care Act was passed. I believe, as many of my colleagues do, I'm sure Senator Durbin and Senator Schatz believe that there are things in the Affordable Care Act to fix and improve and work on and make better. The idea of repealing it just to check a political box to say you did it, and the consequences are so drastic on people's lives in Maine and across the country, I just find unacceptable. I'd like to ask my friend Brian Schatz from Hawaii to join us, and then we're going to talk to some of these incredibly patient young people over here.
Thank you. Thank you to both of my colleagues. It's not a surprise to me that even in his 20s that Angus King was a sensible person who would take the opportunity for a checkup. I want to thank the families here and everybody who is here to stand up for those tens of millions of Americans with pre-existing conditions. I have written remarks, but I'm going to hurry for all of you guys because you've been good so far, and I want to try to see if we can finish on the right note. Look, what the House did was cruel and craven, and it was based on a series of policy lies. And the most difficult to swallow is this idea that they provide coverage for people with pre-existing conditions. They simply do not. The opportunity to purchase insurance at a rate that you cannot afford is not coverage. The idea that you get thrown into a high-risk pool because you have a heart condition, because you have a mental health issue, because you have something that happened to you at birth, because you are a female, because you have had acne, because you have had a bad back, whatever it may be, everybody knows someone with a pre-existing condition. Everybody understands how cruel the healthcare system was before the implementation of the Affordable Care Act. And so this isn't just a policy issue, and this isn't just a partisan issue. This really is a moral question for all of us. Do we care for each other? When we think about our family members, and this is what sticks in my craw so much, is that I know those House members that voted for Trumpcare have to have family members with pre-existing conditions. And for them to wall off their personal instinct towards caring for people that they care about from their policy choice to eviscerate protections for those very same people really is difficult for me to swallow. Now this bill goes to the Senate. But before then, today we will have a CBO score, and it will tell us, we don't know exactly how many tens of millions will suffer. CBO will inform us of their best predictions. And there's a chance that they may have to vote on this again in the House. But one thing is for sure, is that these protections for these individuals will be eviscerated. One last point. You have 13 men. You have 13 men who are by definition wealthy. Some of them don't think they're wealthy. But if you make $174,000 a year, you are doing just fine. If you have health care, you are doing just fine. You have 13 Republican men who are in secret deliberating over the future of these individuals. And so all I am asking is let's have a hearing. Let's hear from health policy experts. Let's hear from people who are impacted by this legislation. Let's have a discussion in the light of day. And if they are confident in their position, they will subject it to the sunshine. I would like to, first of all, thank all the families for being here. And I think at this time, I'll introduce Christine Remy, the mother of Sabrina.
When Sabrina was 16 months old, she was diagnosed with cancer, specifically neuroblastoma. She had a tumor in her abdomen so large that I discovered it myself while changing her diaper. Our family and her medical team fought this cancer through chemotherapy, multiple surgeries, and at one point 37 consecutive nights in a hospital in another state, 5 hours from our home. Like all other families of children with cancer, we were fighting for the chance to give Sabrina a normal life. Our wish was that someday she could pursue her dreams, the career she wanted, the family she wanted, and she could live where she wanted. The great majority of children with childhood cancer, even those who are deemed cured, continue to have significant health issues throughout their entire lives. So we were comforted by the fact that the Affordable Care Act protected Sabrina from discrimination by insurance companies due to her pre-existing medical conditions. We were also relieved during last year's presidential campaign when both candidates assured the American people that they also would protect the millions of children with childhood cancer and other diseases from discrimination based on pre-existing medical conditions. President Trump made this promise again and again, and now, less than 6 months in, he's breaking it. If the AHCA becomes law, Sabrina and millions of other children and families may face a future where they cannot obtain quality health insurance, and where they will constantly have to worry about whether they will be denied insurance if they change jobs or move to another state. I, member of Congress who voted for the AHCA, would be willing to give up their health insurance to be dumped into a so-called high-risk pool. But they don't have to worry about that because their federal health insurance covers pre-existing conditions. While they protect themselves, millions of children and their families stand to suffer a lifetime of fear, doubt, and lost opportunities. Protecting children like my daughter from discrimination based on pre-existing conditions is supported by the overwhelming majority of voting Americans. More importantly, though, it's the right moral choice. Through countless tears and sleepless nights, We prayed for God to save our little girl's life. Now I would ask every member of the United States Senate to protect her future and the futures of children like her by rejecting any legislation that does not unequivocally prohibit insurance companies from denying them coverage based on pre-existing conditions. Being told your child has cancer is absolutely devastating. Being told you can no longer secure affordable, quality health insurance for that child is unacceptable, and our children deserve better. Thank you.
We're going to let all the parents introduce the kids and say a word or two, but let me first call on Michael Pernick, who's with the Adult Congenital Heart Association. Michael.
Thank you, Senator. Hello, my name is Michael Pernick. I'm from Long Island. I was born with a congenital heart defect called tetralogy of Fallot. You may have heard of it. It's the same heart defect that Jimmy Kimmel's son, Billy, was born with. I've had 3 open heart surgeries so far. The first 2 when I was a baby, and the third when I was 22 years old. And despite successful surgeries, folks like me are never actually fixed. We face a lifetime of complications that require highly specialized expert care. As one example, a few years ago, I had a serious near-fatal infection in my heart. I also anticipate needing additional surgeries as I continue to grow older. But in spite of these challenges, I consider myself one of the lucky ones. I have a rewarding career as an attorney in New York, and I have access to top-notch health insurance and health care. I also serve on the board of directors of the Adult Congenital Heart Association, the leading nonprofit in the country fighting for the millions of Americans who were born with congenital heart defects, or CHDs. My survival, and the survival of the millions like me, depends on access to affordable, quality care. That's why the House repeal bill terrifies me and terrifies my family, and quite frankly, it should terrify all Americans. There are a lot of issues with this bill, but I want to take a moment to speak about just one issue that's gone largely unreported, the redefinition of essential health benefits, or EHBs. The House repeal bill will allow states to apply for waivers to redefine what qualifies as an EHB. This is intended to give plans more flexibility, but it will just lead to skimpier coverage, and it will deny me and all other Americans like me with pre-existing conditions the comprehensive set of benefits that we need in order to survive. Even more dangerous, because the ban on lifetime and annual limits only applies to EHBs, if a state gets a waiver and narrows its definition of EHBs, lifetime and annual limits will come back. What's even worse, under current regulations, large employers have the flexibility to set their plan rules based on any state's definition of EHBs. This means that the 110 million Americans who receive coverage from a large employer could be affected even if their state doesn't apply for the waiver. So what does this mean for me and the 2.4 million Americans with congenital heart disease? Well, any narrowing of EHBs related to hospitalization, access to specialists, rehab services, chronic disease management, and many other services would jeopardize our access to care. And since these services are extremely expensive, we would likely hit our annual or lifetime caps if they were reinstituted. I was born with a heart defect. That wasn't my fault. I play by the rules, I do the right thing, but for me and the millions of Americans like me, this bill could leave us high and dry the moment our medical care gets too expensive. Senators, I am under attack. People who have CHDs or other pre-existing conditions are under attack. In fact, all Americans are under attack. I know that you're standing up for us, and for that, thank you.
Thanks, Michael. Thank you. Sydney, you want to bring the mom up here?
Hi, my name's Carla Belcher, and this is Sydney. Sydney was diagnosed with infantile leukemia at the age of 6 months old. She had 2 years of intensive chemo, and we lived in the hospital for the better part of those two years. She grew up in the hospital, and she has a very high rate of relapse in the next couple of years, and then an even higher rate of a secondary cancer coming back later in her life. So being able for her to have access to health care and affordable health care for the rest of her life is... it's not even an option for us. But she's doing really well right now, and we're grateful for that. But she will come with a lot of different different struggles that she'll face from all the chemotherapy that she got later in life. So we'll be dealing with physical, mental, learning disabilities for years to come. So thank you.
Thank you. Taylor, want to bring your mom?
Hello, my name's Amy, and this is my daughter, Taylor. Taylor was diagnosed with high-risk neuroblastoma, stage 4, when she was 18 months old. And like some of the other children here, went through extensive chemotherapy, surgeries, clinical 1 trials and 2 in other states. And she grew up in the hospital as well. She did very well, and then at age 5, because of the toxic treatments she received, she acquired MDS, which is a pre-leukemia. So it's a chemo-induced leukemia, effectively. So all those treatments she had received caused her to have a secondary cancer. And she underwent a bone marrow transplant from an anonymous donor who turns out to be from Texas. We did meet him. After that successful transplant, Taylor went into kidney failure. So she was in the hospital, again, for an extended period of time. She was under dialysis for a number of months. And here she is, 11 years old. She's in school. She's an avid soccer player, and she's a very active little girl. She's still under the care of many doctors. She has side effects. She has sensitive kidneys and sees a renal specialist. She's on hormone therapy. She sees cardiologists. She sees dermatologists. Who else? Neurologists. So there are a number of, she has a whole dental issue that she'll have to, that will be addressed as she grows older also because of radiation that she received to that area of her body. So she's not out of the woods. We have lots of care that is required for Taylor. I can't imagine what that would look like without insurance coverage. And I applaud you, senators, for working towards keeping something intact for our children as they grow up and look towards the future. Thank you.
Madison, want to bring your dad up?
Hello, everyone. I'm Edwin Garrett. This is my daughter, Madison Garrett. She, Madison was diagnosed with stage 4 high-risk neuroblastoma at the age of 3. She had a tumor in the size of her stomach, the size of a cantaloupe. And through many bouts with chemotherapy, radiation, surgery after surgery after surgery, months in the hospital getting stem cell transplants, she survived. She is now a 3-year in remission, been in remission for 3 years. And it's always ironic, not ironic, but it's always difficult for me to look and see other children that have gone through this and to think that that they battled, and we ask them to battle and fight to survive, and they go through all these treatments and they lose a part of their childhood, and their childhood is shaped totally differently than, they're so used to being in the hospital and things like that. We ask them to battle and fight and fight and fight, and then when they finish fighting, we tell them that, oh, healthcare is not for you, it's for people who are healthy. You know, you've already won your battle, so now we'll just, kind of put you in a pool, a high-risk pool or whatever, and you can't have health insurance. So if something else happens, or your parents want to change their job, or, and you lose your insurance, sorry. And that to me just doesn't sound right. I'm a special educator. I teach children with profound emotional disabilities. And one of the things I always teach them is when you're about to make a statement or do something, think about it, talk through it, and listen to it. Does it sound right? So I kind of, and not to insult any congressmen or senators, but I kind of asked them to do the same thing. If you hear what I just said, or just think about it, a child's battled for years, spent years in the hospital, fighting something that they didn't ask for, they didn't want. And then you tell them, oh, well, can't have health insurance. We're glad you're okay. We prayed for you. We stood in front of cameras and said how horrible it is. But now, oh well. I'd ask them to talk that through in their head and then make their decision on how they want to vote. So,
Thanks. Very well done. Thanks, man. So it's hard to imagine what many of these families have been through. A lot of sleepless nights, that's for sure. But we don't want them to have sleepless nights over whether they have health insurance in America in the 21st century. And that's what this is all about. So we'll be happy to answer any questions. Yes.
Talk about the CBO score, just what you expect to see, but also just how important it is in terms of just another element to your argument. You've got the policy arguments. But.
The fact that the House Republican leadership raced this bill through without a CBO analysis and score tells the story, doesn't it? They didn't want this to be public ahead of time for fear that they'd lose Republican votes and lose public support. I don't know what it's going to say. If it's anything like the first score, and I think it's likely to be, it's an embarrassment to think that we would consciously make a decision in the United States Congress with the president to take health insurance away from 10 or 20 million Americans, to go back to the bad old days that we've described here. I'll wait and read the details on it, but I'd be shocked if it's much of a change over the first version. Don't ask me, ask the American people, and they say yes. It's time for us to consider a public option, a not-for-profit option, something that looks like Medicare. The American people are ready for that conversation. This is really, I think, my personal view, I don't speak for my colleagues, this is private health insurance last chance to show it works with these exchanges and with subsidies and premiums. And if it doesn't work, we should move to something that gives people peace of mind. Medicare sure. Here's what we believe. That is, the current system under the Affordable Care Act needs continued support from Congress and the President. And as Senator King and Senator Schatz said, we all agree it can use some improvement. But the Republicans should not be allowed to sabotage the current healthcare system in America and then claim it's somehow in a death spiral. It's only in a death spiral because they've got their hands around its neck. As far as I'm concerned, we ought to be working to keep the current system in place and improve it where we can. But repealing it or letting it wither away because of congressional inaction would be horrible. I'll let my colleagues comment on that. They should hog the microphone. Uncertainty. Uncertainty is what they tell us. Are they going to get this special funding from Congress, which they're anticipating? What is the market going to look like next year and the year after? That uncertainty is really the reason why many of them are making business decisions to be safe and rather than sorry and to remove themselves from the market. Anybody else? Okay. Thanks, everybody. Thanks, Brian. Thanks, Mike. Hey, absolutely.
I also really want to thank you for being such a leader on CHD.
Well, you know why. Yeah, my daughter, she has
Shake their hand.
transposition, tetralogy. I certainly know about that from a long time. You look good.
I do. I feel great. I feel great. Yeah, it's going really well. It's
Great.
going really well.
Great.
But really appreciate you being
You
such
bet.
a leader, and we all know it. We all
Good,
know it.
good.
Could I